very good. Well, my name is Mark Sherman. I am the host for the Cycle Power Summit, and I'm super excited this morning to be joined by Dr. Martin Owen. Thank you so much for being here, Dr. Owen. Hope you're doing okay out there in Calgary this morning. Welcome.
Doing great. As we
Yeah.
discussed, getting some nice warm weather, so we're getting out from our hibernation up here in the frozen north. So wonderful to be doing this with you and on the Cycle Power Summit.
Yeah, that's great. Well, when you talk about negative 30 degrees, I think anyone that's in any part of the country listening hopefully has this big sign of relief that we didn't have to endure what you did for this winter season.
Yeah, we take one for the team up here in Canada.
Yeah, you sure do.
Yeah,
you have a whole different appreciation for what springtime means for you guys. So
that's right.
But we're lucky to be with Dr. Owen. He is a medical doctor from Queen's University. He's also a fellow with the Reproductive Health and Research Institute. And then you also founded your own Vitae Solutions, Medical Solutions. So you have many, many years of experience in this space of reproductive health. And I think it's super exciting to not only have your background, but your passion for this topic. And then certainly as we get into the discussion today, we're actually gonna be talking a lot about the male side of infertility, which, as we've discussed, is sometimes overlooked as women generally become the focal point here. So, but before we jump into that, love to just get a sense of, a little bit about you and what got you interested and passionate about this type of work.
It really goes way back to my own conception, if you will. It goes, my family's, my parents were fertility educators with the Billings ovulation method.
Oh, wow.
Started training with them in the late 70s prior to, I'm going to date myself, but prior to when I was born, and brought me to a fertility conference where I got to meet the Billings who developed the method while I was still in utero. So, I said I haven't confirmed with my mother that maybe I leapt for joy, but while still in the womb. But so I kind of came at this, if you will, right from the get-go in my medical career. I knew that I was, going to be providing a restorative reproductive approach in my practice. I was going to be offering couples fertility awareness-based methods. So I originally sought training through the Billings method.
Okay.
And would call myself, or at least use the idea of being what I would call an ecumenical NFP, or fertility awareness doctor, meaning I want to be able to provide myself as a resource to couples who are using any method or any tools, not being method specific per se, but trying to be as knowledgeable as I can to support couples in the journey where they're at. Since then, I've gone forth and done some more training with FEM through the Reproductive Health Research Institute there in New York. So learning more about using the cycle as a diagnostic tool and applying some medical protocols to the diagnosis of women.
Sure.
In my passion to see fertility tools kind of promoted and integrated, including some of the newer technologies that are out there, that kind of prompted me to found my own company called Vitae Medical Solutions. And really, for me, that's a vehicle to help bring some products and tools to market that may be being developed. So bringing those to the Canadian market, but also forwarding what I would call kind of important changes for virtual healthcare platform issues, ways that we can connect better with our patients and collaborate as natural fertility professionals.
Sure.
So it's kind of an exciting time to be involved in this area. Yeah, as we see really a massive shift, I believe, in the culture where many couples are seeking fertility awareness methods to understand their health and fertility, and are coming at it just as an honest expression of their desire for a more natural approach to their reproductive health care.
Yeah, it is. It's exciting to see, for people that take that step and want to be educated and want to understand their bodies and what's happening. I think the process itself could be such a uplifting, motivating, and there's just such great avenues. There's so much great work that is being done in this space, and and a lot of this stuff is not invasive. It's not financially overwhelming. It's amazing how there's been such nice advancements in this space.
That's right. And it really gets to the heart of the issues. That's an engaged process with the couple, and it's centered around that. So I think that's very empowering for both the man and the woman involved in the fertility journey to have that more restorative approach to care.
Yeah, and not a one size fits all, right? That regardless of what we might ask or learn from a chart, this is with the 3 steps that we take. It's really getting to the individual and putting something together that makes sense for them. So it's been great. I've learned so much over the course of my work personally, and then interviews like this, and it's just an outstanding options for couples. So that's super. So let's talk. We're going to shift a little bit of this conversation, and a lot of this is that we're kind of highlighting that there's been lots of advancements as it relates to fem tech, but let's talk about it specific to males and bringing them into this fold, bringing them into the discussion. Let's just start off with what are some of the issues that are facing men as we think about this fertility journey that couples might be on?
Yeah, I think we need to start with where men have been, in a sense, overlooked. We often think of, okay, fertility, the more complex system is the female system. We used to think maybe 75% of fertility issues are weighted on the female side and only 25% on the male side. But there seems to be a creeping shift that men and male factors are more and more accountable for issues with fertility. So we may be getting closer and closer to a 50-50 split in terms of fertility issues. So, but men aren't really well aware of this. So we've got sort of a knowledge gap here at the very beginning that men kind of think, oh yeah, it's kind of an afterthought. Oh, fertility, no problem, right? It's right. Not something that I have a problem with, because we don't have, in a sense, we don't have cycles that are telling us on a month-to-month basis, maybe something's not right with our health. So we've got this overestimate of our ability to father children throughout our reproductive life, but especially as with women, as we age. So many of us are maybe starting families later on in our life and thinking, okay, we're going to have no trouble, no problem, at least not on my side anyways, right? So we have to look at that and say, hey, look, where are we lacking in knowledge about our own fertility risk factors? For a lot of men, in the culture, of course, artificial reproductive technology, IVF and the like, is kind of held up as the solution. And we think, oh, if we need technology help, it's going to be available, and it's going to be easy, and it's going to be effective. And, as you were sharing about your work, we know that it can be a difficult and painful journey through those kind of technologies as well. Overall, I would almost say, it's a ubiquitous experience that men are not really consulted early on in the fertility journey. It's like, let's focus on the woman, and once we've looked thoroughly at the female side, then we'll turn over here if we can't discover anything. I think it's always good to have our eyes open at the beginning, optimize a couple's health by focusing on each of them in there. And from a fertility awareness perspective, I always encourage men to be highly engaged in the process. I don't think there's great communication always, or tools for communication within the relationship about what the shared fertility goals are, whether they're avoiding or trying to achieve pregnancy. I think that foundation of being united in communication is where you're going to have the best, not just effectiveness, sort of best, if you will, reduced time to conception or confidence in avoiding pregnancy. But when those fertility goals are shared and they're communicated well, and they're integrated in the couple's daily life, I think that's where you're going to get the best overall experience. So that's sort of where we're at currently.
That's a good point. I mean, you would think that at the headline level, it is shared. We want a child. We want to build our families, but when you start to talk about a lot of the day-to-day decisions that couples are up against in terms of what things they should do or not do, and how they're both being looked at, treated, considered, as a whole couple, it gets real fast, and there's a lot of things that need to be. I love this idea that if you're not in alignment, if you're not clear in terms of communicating, and some of that could be the fears and worries and concerns, not having that harmony across that couple, it's a big deal. They'll need that, not just on their journeys to parenthood, but on the next phase of life when kids are in the mix. So it's a really good piece of advice, I think, that might seem very basic in terms of a shared goal is a child and building a family, but to stay in alignment in terms of how you get there, that's powerful.
Right, because initially, if we look historically at kind of the man's engagement, I kind of, would joke about, well, in traditional charting methods, maybe the man's engagement was putting a sticker on a chart on a day-to-day basis. And as we've moved more towards women charting on apps and utilizing technology in their smartphone, although some people would laugh, well, that's the man's engagement to put a sticker on a chart, that was at least a daily marker of engagement, that a conversation had occurred, that maybe the fertility goals were discussed. Definitely not, I say, a highly user-focused engagement, one that could be trackable. But sometimes when the fertility discussion gets hidden in a smartphone app, there isn't that male partner engagement, at least potentially.
Yeah.
So in this sort of tech focused transition, if you will, for women, we've seen certainly less engagement of men from a technology perspective. I think that's one opportunity we have going forward, to engage men in the process of the charting and also in the rest of their health journey.
Yeah, no, I couldn't agree more. I think there's the physical aspect of having the males involved, and then there's the emotional component, and then the dynamic across that couple, and how critical it is that they're all considered, as part of valuing that as part of the process, for sure. So what are some of when you see, you think about male fertility and getting males engaged, and to your point about the diagnosis, that in the past it was really just kind of a lot of this was on the shoulders of women, and now there's a lot more evidence that there's a male factor here, potentially more statistically relevant than we thought. But what are some of the factors that you see playing into male fertility?
Yeah, so I think it's very important for men to have an evaluation of their history, their medical history and their current lifestyle, because there's a few things that can kind of pop out very, very easily from their history. Things like smoking, and in Canada with legalization of marijuana, smoking marijuana can have a big impact on fertility. Alcohol use, things like your weight. Are you in a healthy weight category? Are you someone who's suffering from severe stress-related symptoms? Have you had issues in the past with infections? Say infections in the testicles or the tubes, or maybe sexually transmitted infections in the past. We tend to downplay those in the male as well. Certain types of occupations where men are sitting for long periods of time, dealing with overheating of their testicles can be a significant issue. Or occupations where they're exposed to certain kinds of toxins. So I think we need to go through a man's history or give them tools where they can assess these underlying risk factors easily. Sometimes activities that men enjoy for their own health, things like long distance biking, other activities that are putting kind of consistent pressure in the groin area can be a huge factor as well. There's many other things. So history of a man not having their testicles descend fully when they were a child, so needing surgery to correct that. Certain kinds of hernias or other swellings in the tubes there in the groin are also important things to evaluate. And really, it's just about taking a thorough history for men, or as I mentioned, for men to have this awareness in the background and be proactive. Hey, wait a minute. I do
Yeah,
have some of these factors that could decrease my fertility. What can I do about it now to optimize my health,
sure.
so that we can have a more easy time with our fertility?
Yeah.
Yeah, I mean, men do have the advantage of having a lot of, if you will, a redundancy in the system. We produce a lot of sperm,
Mm,
and so we can deal with potentially some of these fertility issues by just having an overwhelming, if you will, response, whereas a woman, of course, has got to have be releasing her single ovum, if you will, per cycle,
yeah.
except in the cases of twin pregnancies and so on, but
Oh,
have everything working for that one event. So
yeah.
that's why I think we've got this psychological background that, well, everything's going to be fine for us.
Yeah,
Yeah.
I think so. You're right. And I like the fact, and there's lots of, I mean, I think when you went through that list, it was almost overwhelming in terms of there's lots of factors that could influence them. And to your point, not all bad things, smoking and whatnot. There's just the type of exercise, the type of work that we do, and other things. So, how do you, if you're early on in this journey, what do you see as the best way to actually bring some visibility to if there are issues on the male side or not?
Yeah, I think it really, got to put the onus back on how we engage the man, because often the man isn't going to come in to the office early on in the journey. He may, but it's not normally it's kind of the first thing on the man's mind. I better go in and get checked out by my doctor. So I really think we do need to focus on how we engage the man right from within, the method that the couple's using to chart. So having those, say, health focused questionnaires and engagement for the man right within the platform that they're using, I think is an excellent way. What we see kind of in the technology space that's happening is mostly, I would say, at home sperm sample technology. So they're trying to bring the awkwardness of having to give a masturbated sperm sample in a lab into the home. Now these are, in a sense, I guess, useful tools, but they don't align with the restorative reproductive approach, where we're taking the sperm sample from a masturbated sample instead of from an act of natural intercourse, which is obviously essential for the conception of a new child, right? So, and we're not bearing in mind that from a quality perspective, there's good evidence to suggest that gathering a sperm sample from an act of intercourse, even with a perforated sperm collection device, has better quality sperm sample than a masturbated sample. So it's not just, say, for couples who have, say, an opposition to that approach due to psychological factors or medical factors or cultural factors that they wouldn't want to provide a sample like that. There's good evidence that getting a sample from intercourse is the best way. So, although it's useful for men to have the knowledge of, hey, what is my status from a
Mhm.
sperm count perspective, I think that some of these tools aren't engaging man in that process of what's my health status, why is my sperm count affected by that, and what can I do to improve that?
Sure.
Yeah.
Yeah. So I think that's just got to be a really good level of education for people in terms of how the sample is actually derived, and that there's actually, outside of it might not aligning with your values and whatnot, there's also a quality difference in terms of the actual what the results and the sample that you can get. Are there particular, did you say there's techniques to actually capture the sample through intercourse? That is there anything worth there sharing with someone on what that process looks like without being graphic, or is there tools to help with that?
Sure. So really the best way, and what is to use a what's called a seminal collection device, or was basically a condom with some perforations in it that could allow for conception to occur if that's what's going to occur during that active intercourse, which then can be removed immediately after intercourse and then transported to a lab within 15 to 20 minutes while keeping that sample warm close to the body. So the one product that recently has come into my attention more and more, something called the male factor pack, which is just a condom that's not harmful to sperm, that can then be used and labeled and brought to the local lab. Now, part of the issue can be whether the lab will indeed accept this as a sample, because they're just routinely taught this is how a sample is done. Man comes into the lab, provides a sample there at the lab, and that's the way it's done. So
Right.
I really think it's important to engage a laboratory that you're going to use to ensure that that's appropriate. And I'm going to be doing so with my local laboratories here upcoming to make sure that patients can be utilizing these devices, these collection devices that are much more, how would I say, I'm going to provide a better sample, but also more in line with their values. And really, I mean, for everybody, whether you have a problem with the process of masturbation, it's a more comfortable, life-giving, loving way to give a sample in your fertility journey.
Sure.
Which aligns with your goals, which is to try to conceive a child.
Right.
Yeah.
Yeah. Okay. So good. So there are some options out there for people. It's just a matter of some coordination with the lab to see if this is protocol and if it would be accepted. And hopefully more and more people are open that might be a different way, better way to potentially do this.
For sure. And I think there's a way that can engage some of these at-home devices, which are very, I do like the user-friendly nature of them, but I just think that people don't have their eyes open who are developing these, that, hey, wait a minute, a post-intercourse sample would be the best way. Why don't we, study that in our development process and then make that available? Because I think that would be the most user-friendly option. Some of these devices say turn your smartphone camera into a sperm analyzation device, or have ways at home for you to measure the quantity and volume and concentration of a sperm sample at home. But why not post intercourse? I think that needs to be pushed a little bit in the men's health technology sphere.
Yeah, no, I agree. So what you just touched on a couple of things, but what do you see as your outlook for how technology can advance, maybe just to do some of the things that you said? Because as of right now, I mean, the message here is that we got to bring the male into the discussion, both emotionally, but physically. We need to understand statistically how they are performing. If there's any lifestyle factors that could be adjusted and changed to help improve their situation. But yeah, what do you see as you look at the future horizon for the male side of this, of continued technology or other means to help keep males connected, involved, in contributing?
Right. I mean, from as we discussed at the beginning, right, from a foundational perspective, we want to get the communication piece down. Now, there were some technology advances or apps that were kind of brought out to help men, if you will, navigate the changes that occur in their female partner throughout the cycle. And some of them are fairly crude, communication tools. I would say not really a mature way to look at the integration of a couple's sexuality. So apps that were kind of trying to predict your couple's your female partner's mood based on rhythm calculations. It was almost, as I would say, crude or crass. It wasn't focused on fertility goals. It was more like, oh, watch out, there's a high chance of aggravation today because of where she is in her cycle. And you're going, well, this is not really directed at a mature response to a loving sexual relationship. And again, didn't have anything directed towards a couple's shared fertility goals. So I think that's one area that needs to be well established. And then I've been kind of working on formulating ways that we could engage couples across all methods to have a robust companion platform for men, where on a day-to-day basis related to what the female partner's charting, we're giving men really focused advice, actionable advice based on what's happening today and what their fertility goals are and what their past medical history is, what can be done to, one, support their female partner in those shared goals, two, support their own health development, and three, really close that communication loop and be consistently united in that respect. So I think that's one area where work needs to be done, and I think this is going to be an ongoing area.
Yeah.
From a technology perspective, there's not a lot out there in the urology, the specialists that deal with surgical issues for men, in terms of testicle prior trauma, hernias, those sorts of things. There's not a lot in the literature that talks about kind of an engaged or restorative process for men's fertility. So it would be great to see a little bit more work in the literature about that, in terms of, say, correcting things, say hernias or issues with the tubes that carry the sperm, instead of just going towards artificial reproductive technologies.
Right.
Yeah.
Well, what are, just to touch on that, because I think it's someone listening, whether they have already headed down this path of getting the male side tested or they will, what are the top few diagnoses, if you will, that might come up as a result of taking a deeper look here? And then I'd also like you to just comment on how much is out there to restore that. What are some of the things that, is this a death sentence by any means, some of these particular diagnoses, or are there things, like you said, that can be changed amongst the lifestyle that actually can correct and bring some of the normal levels back? But yeah, let's start off with, what are some of the things that people should be aware of in terms of what they might get as a result of doing some testing?
For sure. So typically, as we mentioned, the process of doing some testing for a man, we want to evaluate the history, and we've talked about those things already. But if a man goes in and gets a sperm sample and we come back with, say, the sperm count is low, or that the sperm aren't functioning very well, we think, well, there could be many reasons for that. So say from a surgical perspective, we want to make sure there's no swelling in the tubes that are coming down, up from the testicles and into the abdomen there before coming out. So sometimes you'll call those varicocele, so swelling along there and inflammation kind of in the tubes. You want to look for things like, swelling from infection or other inflammation in the epididymis, so epididymitis. Sometimes these can be from sexually transmitted infections. So we want to evaluate these things and treat them. If there are issues with hernias in the area, so hernias in the groin can sometimes be putting pressure on some of the tubes, causing swelling in the blood vessels or tubes. So these are things that can be structurally fixed and normally have a good success rate at restoring normal function to the testicles. And it can take some time after a surgical procedure like that for sperm samples and counts to come up. But it's definitely not, a death sentence here.
Sure.
When you're changing lifestyle factors, you're normally going to recognize that it does take time for those lifestyle factors to affect healthy sperm concentration. Because sperm isn't just being produced, today. There's a process, a timeline that sperm gets produced prior to, it being available for that active intercourse on that day. So I normally will tell couples it's going to take about 3 months of healthy lifestyle changes to kind of have well established increases in sperm count.
Okay.
Fortunately, I think there's really good evidence that utilizing cycle charting and having a great knowledge of when the female partner is fertile, and to target intercourse in those times can help even men with lower sperm counts. There's great evidence in the naprotechnology research that targeted intercourse, even in men who have failed, couples who have failed artificial reproductive technology, still has a good success rate in helping couples conceive. So I don't think we should underestimate, just having a great knowledge of the reproductive cycle can be very helpful as well.
Yeah, no, that's great. It sounds like things are, the information becomes knowledge. There's lifestyle changes that can help improve things over several months. And then the fact that we can be far more targeted by understanding cycles, it allows us to try to mitigate, any factors that might exist here. So I think that's excellent and should be encouraging if someone is certainly dealing with an issue here. So this was, you know, from my perspective, I think this is such a healthy dialogue because it is the overlooked aspect in many ways. And I think even women feel like that the ownership, regardless of even diagnosis, we sometimes hear is, it's just, this is their bodies and this is why they're put on the planet. And there's that responsibility and ownership. And I think that this is a shared journey. And I think that to get the facts and to come together as a couple and in both, you know, to work to put themselves in an optimal position, you know, regardless of levels, a healthier relationship, healthier marriage, healthier people, regardless of just the outcome, baby is just going to lead to a great change in their quality of life and ultimately, I'm sure, help on their journey forward. So I think it's great. There's probably not as much attention around the male side of it. So I think that it was great that we had this conversation. As you think about, you know, in these interviews, we have this one cycle power tip, this one message that you'd want to leave the audience. As you think about all the things that you covered today, what would be one message that you want the audience to leave with today as a tip?
Yeah, thanks so much. I think, you know, to summarize and to give the, you know, the cycle power tip, if you will, for men is really to stay informed for one and to stay engaged. And I would say that's on a daily basis, that we know that couples who are where the man is staying informed and staying engaged are going to have a better satisfaction in their fertility journey, are going to feel better supported in their relationship. And for men, it's about taking you know, that responsibility for not just your side, but for kind of leadership in that journey that's been placed on the woman. So stay informed and stay engaged, and you know, hopefully more tools are going to be coming your way to help that.
Yeah, no, I mean, I think that's a great way to end the session, if you will, because it just leads to a healthier marriage. And I think that because women, in acknowledging that generally women are feeling like this is on their shoulders, on their back, there's certainly an endless amount of supply of information they're getting of things they need to be considering and thinking about. And I think it's just a great gesture, right, to come forward and to get involved and get engaged and contribute to this process. It's not about who's wrong here, who's the problem. And I know there's that phase couples go through of, gosh, I hope it's not me. I hope, you know, I know for my wife Erin and I, is it her? Is it me? You know, no one wanted that responsibility of letting the other person down. But I think regardless of diagnosis, it's a shared journey and miracles do happen. But I think what's at the center of this should be two people equally vested in this process moving forward, not one that's got all of it and someone that, you know, not as much. I just think that alignment and connection and validation is really important. So I love it. It's a great message. We'll keep doing our jobs, both of us, to make sure that this is a mutual, you know, process, which, gosh, shouldn't it be? You know, we're talking about saving life. I mean, it's not a bunch of to-do items. It should be this great unity and connection that exists between a couple. So yeah, it's incredible. I couldn't agree more. Yeah, any final thoughts or words on your end? I want to make sure you were able to cover everything you thought was most important to the audience.
You know, as I always tell men in taking responsibility for their fertility journey, men, you're fertile 100% of the time. You know, a woman's only fertile for a short amount of time during the cycle. Well, that can also, you know, we can use that on the flip side. I use that to help men get engaged in the process, saying, hey, wait a minute, you know, this really is, you know, my responsibility if we're avoiding conception, but it, you know, equally weighted. It's also your responsibility to be 100% engaged in the process when trying to conceive. So I just leave men and couples with that little tidbit that it's a great way to kind of bring men into the conversation and kind of open their eyes to the responsibility that they have.
They do. That's excellent. That's a great way of looking at it too, for sure. That's awesome. Thank you so much, Dr. Owen. What a great, insightful conversation. I love the work that you're doing, and continue to keep us posted as things advance in this area, because I would tell you what you just shared in terms of the technology and different ways of looking at this process is, you know, I would have to say most people are probably unaware that there are some empowering choices for people to take control and to honor themselves and their values in this process. And what a great message that is for people. So thanks for the education, for sure.
Thanks for your work as well, Mark. It's a pleasure to speak with you, and to collaborate on these most important areas for sure.
That's right. Yeah, we'll
Yeah.
keep doing that. So thanks again. Have a great
Very
day,
good.
Dr. Owen.
You too. Take care. Bye-bye.